Why we are here is to accomplish one of the very important initiatives that the school has already started with the team Health X, that is in terms of telemedicine. As you are aware, is that of late or currently, the whole of the nation, including our particular county, we have already started going paperless, and therefore this means that we must have to, follow that kind of trend direction that has come all the way from the national government in terms of going digital. And therefore, meaning that you don't need to have a lot of logistics in terms of consulting and looking for specialists and etc. Meaning that we are able now to consult, through telemedicine or through virtual, without the doctor being physically with the patient. I think this is one of its kind and the first particular school that has initiated this kind of a virtual clinic. And therefore we were here to witness and open this very important clinic so that the team which is in Nairobi, the consultants and the medical officers who are being consulted from Nairobi by the patients or by the students can be in a position to give guidance and prescribe the drugs that are required for these particular patients, even when the doctors are quite far away. I want to believe that this is the way to go because, as you are aware, if we talk about specialists in our day-to-day service delivery in terms of health, you find that we have some certain particular specialists who are very, very, very few. And therefore, when they are such few, it means that the populations are more than what they can handle. And therefore, with this kind of electronic method of treatment, we can say that we shall be able to meet quite a big number of our clients who need those particular specialized services. And therefore, we can only say that we are happy because of this particular initiative. And we would like to to do a replica of such kind of an initiative in every other school so that it is easy, so that the logistics are easier for the schools. The expenses are even less for the patients and also for the particular patients that are suffering.
We're launching a virtual clinic here, which the pupils can access at any time. This is because, it could be, even the cost of healthcare, it could be very expensive to have a doctor full-time seated in schools. And in most schools, you're also not very sure how the health of your child is. More so a boarding school like the one that we're seated in, but even day schools. If you have a child with chronic illnesses, children are also prone to injuries. As a parent, you want to be at home and at least comfortable that they are healthy. So we've launched a virtual clinic that is right behind me. And what it guarantees is that anytime a student or a pupil falls sick, you do not have to wait until this child is too unwell. It doesn't have to get to that point where the child has to go away from school, getting sick of days, missing academic days, not performing too well. So they can get their care as soon as they need it, immediately they need it, get a direct consultation with our main clinic at HealthX. This is done mainly through video, but we also allow voice calls, and it is guided by a well-trained health professional so that all through the experience, they are having the right quality of care. Thank you. A grade 6 child is having a very bad headache and they can't concentrate in class. The procedure that will happen is that they'll walk into the virtual clinic where our healthcare professional is seated. This healthcare professional will make sure that this student, despite being unwell, is stable enough to be treated by virtual services, because some of them need to be rushed immediately for physical treatment. So once the nurse does what we call a triage, does what we call vital signs, takes the vital signs of the patient, of the child, at that point, and registers the child. At that point, the child will then be dialed in via video call through our secure applications to speak to a doctor on the other side. They'll speak to the doctor, and then the doctor will make recommendations from there. Either it will be a prescription, either it will be a lab order, either it will just be instructions like, let the child rest for 6 hours or something. And at that point, what will happen is this order will be printed and the child will receive it, and then care will be, if it's medication or a referral that's required, it will be delivered from this side. So you see, this child does not have to go to a hospital, does not have to queue or be made to jump a queue, because at least in most hospitals we give children privileges. We also eliminate that fear of hospitals that children sometimes have. So it's a little more comfortable to the child, a little convenient. You find that they actually don't wait too long when they're feeling unwell. It's very easy to access.
The students and the members of staff are able to access good quality healthcare while in school. You are aware that a student, like anybody else, fall sick when they're in school. And that is very normal in all schools. So the question is, when this child falls sick, how does the child assess treatment? Before, you have a handout of charges, because children will get sick. We are boarding school. Some will get sick in the night. We have to reorganize the school van, get the teacher to take the child to the hospital there in Kerugoya town. Sometimes it could be a charge to get that particular specialist to handle that matter. And therefore, the virtual clinic that is being offered by HealthX Africa in our school will help be able to address that challenge, because children can access healthcare right in the clinic in the school, virtually, 24/7, morning and evening. We have got a residential and professional school nurse who is able now to get attend to the patient, the student, and now be able to link now the student with the virtual doctors in Nairobi. We have got good connectivity of the internet and the gadgets that are needed, and therefore we have seen it work for us, because one, it is reducing the cost of treatment. Before, we would call the parents to send the money for treatment. Sometimes parents are not reachable and the child is sick, so we'll be forced to go back to our pocket and treat and give the money for treatment. But now, when a city has 700 shillings, it caters for consultations throughout the term, during the school and over the holidays. So the child is able to be attended. And then after prescription, we will go there in town and get the medicine, and the child will take the medication and will get well. So parents don't have to travel all the way from Nakuru, from Nairobi, from Mombasa to come and take the children to hospital. Sometimes it would happen that way. A parent will insist, I have to come and take my child to hospital. So even for the parents, it's very convenient. Therefore, we are very grateful for HealthX Africa. We are very grateful for the county government of Kirinyaga for their support and guidance. And we are very grateful for the parents because of their support of the program. We hope that this program will be taken by other schools as well, because I can advise them that virtual treatment or telemedicine is the way to go.
And do not really know what is the problem, with quite some pain.
The introduction, then she's the one who receives the call and then directs the call.
Okay.
Yeah.
Very well.
5 minutes.
They're all held up.
Yes.
You're the only one experiencing these symptoms, or
I'm the only one. It seems like the doctor is hearing me. You are disconnecting somehow. asking for doctors to come see the patients, or even taking the patients outside the particular school to hospital. Officially open. Makofi ko wapi?
Right now, you see, we don't have to have our doctors sitting here. We've even added nutritionists, psychologists. They can be treated remotely. Then the child, and you can see when they sit, is too small even to
Bunny. Okay.
care coordinator. She's the one who determines which kind of care you need. A doctor, a complex. Yeah, depending on.
Good. My name is George Karoki. I'm the Minister for Medical Services, Public Health and Sanitation in Kerugoya County, and I would like to see how you operate this thing.
Yeah, we will do a small demonstration, but first I want you to launch the clinic.
Have you used any painkillers for the medication?
I'm not taking